Did you know that a dog who stops breathing only has 3 minutes before brain damage becomes irreversible? Just 3 miserable minutes. And, let's be honest, most of us owners waste half that time in a full-blown panic attack. But, what if I told you that with the right knowledge, you could turn around a critical situation before your vet even opens the exam room door? Today we're going to break down the 5 most common emergencies that happen at home, and I'm going to teach you step by step the exact way to respond. That way, instead of becoming just another victim of panic, you'll become the hero your dog needs at the right moment. No, you don't need to be a veterinarian with years of study. What you do need are 2 steady hands, a clean towel, yes, a clean towel, and the calm that your dog in that stressful moment won't be able to have. We're going to go step by step, breaking down each scenario. The idea is that when you finish watching this video, not only will you feel more confident, but you'll have such a clear action plan that you could print it out and stick it on your fridge door. Because preparation, my friend, is everything. Let's start with the first situation and one of the scariest. A choking dog. Picture this. You're just relaxing and suddenly your dog makes a harsh sound, like he's coughing up a bone, followed by a desperate gasp for air. You might see him pawing at his mouth, or notice his face, tongue, or gums starting to turn blue. Maximum alert. The first thing is to stay calm, no matter how hard it seems. Before you stick your hand in his mouth blindly, take a good look. Can you see the object? If it's something round and slippery, like a small ball or a piece of sausage, be careful. Don't try to pull it out with your fingers. Most likely, in your desperation, you'll just push it further in and make things worse. Here's the safe technique. Carefully open his mouth, grab his tongue to get a clear view, and with your thumbs, make a sort of click under the jaw, right at the base of the throat. Sometimes, that little movement can dislodge the object. If it appears, and only if you can grab it firmly without pushing it further, remove it with a pair of kitchen tongs. Yes, the same ones you use for pasta. If it doesn't appear, we move on to plan B. Lay your dog down on his left side. Place your closed fist, but not tense, right behind the last rib arch. That is where the rib cage ends and the abdomen begins. Now, give 4 quick, firm thrusts upward, as if you were trying to push the diaphragm toward the chest. This maneuver works great because the diaphragm acts like a piston, forcefully expelling the air and, hopefully, the object that's causing the problem. Check the mouth again. Is it still there? If you have to repeat the maneuver, and here's a crucial point, even if you manage to get the object out and your dog seems fine, always take him to the vet. A piece of bone or a toy with sharp edges, for example, could have left microtears or irritation in the esophagus or trachea, which can become infected within 24 hours and cause serious problems. Better safe than sorry, right? Let's move on to the second situation. Blood on the floor. Could be something as simple as a broken nail that won't stop bleeding or something much more alarming, like a deep wound. No matter the cause, the initial protocol is the same. Direct pressure. For this, the towel we mentioned at the beginning is your best friend. Cut a clean piece, fold it into a square, and press it with the palm of your hand directly onto the wound. Keep this pressure firm and constant for at least 3 minutes without lifting it even for a second. The most common mistake I see is that almost instinctive urge to take a peek every 10 seconds to see if it stopped. Every time you lift the cloth, you tear off the clot that was trying to form and the bleeding starts again, or even worse. If the fabric gets soaked, don't remove it. Just put another one on top and keep applying pressure. The key is patience and consistency. Now, what if there's an object stuck in, like a nail, a branch, or a piece of glass? Under no circumstances should you remove it. Removing it could turn a bleeding that was maybe under control into an uncontrollable gush, because the object itself might be acting as a plug. Instead, surround the object with clean bandages or more pieces of towel and secure everything without moving the object. The idea is to immobilize it to prevent further damage and more bleeding. While you're applying pressure and stabilizing the situation, don't waste any time. Call your veterinary clinic right away and let them know you're on your way. Tell them what happened. This will give them time to prepare the suture kit, the operating room, or whatever is needed before you arrive. Every minute counts in these situations. Third situation, and one of the favorites, sarcastically speaking, of veterinarians. Your dog jumps off the couch or the bed, or maybe is playing in the park, and suddenly you hear a crack. Then your dog doesn't cry, doesn't whimper, but just won't put weight on the leg, keeping it in the air. Most likely, we're dealing with a fracture, and a tibia fracture from a bad landing is a classic. Your main mission here is just one thing: immobilize. You're not a doctor, you're not an orthopedist, you just need to prevent the leg from moving more than necessary, which could make the injury worse. Look for anything rigid you have on hand. Place it on both sides of the injured leg, making sure it extends beyond the joint above and below the fracture. Then, secure it firmly with adhesive tape, a scarf, a handkerchief, or even elastic bandages if you have them. It doesn't have to be a work of art, just firm enough so the leg doesn't bend or move. Once it's immobilized, the next challenge is transportation. If your dog is small and fits in a carrier, use it, but do so very carefully so you don't strain the joint. If your dog is too big or the carrier is uncomfortable, remove the top and lower half of the carrier over them, or use a blanket as an improvised stretcher. Secure your dog well in the car, preferably with a seatbelt to keep them stable. And here's a golden rule you can't forget. Never try to set the bone yourself. Only a veterinarian, with the help of x-rays, can know exactly what type of fracture it is, if there are loose bone fragments, or if there's a risk of injuring important blood vessels or nerves. Your job is to stabilize and transport. The veterinarian's job is to diagnose and repair. The dog, with its innate curiosity, smells something delicious that just came out of the oven or off the stove and, in a second, gives a lick to the metal that's just been taken off the heat. The tongue swells up in a matter of seconds, and you, as the owner, start to panic. Immediate response is crucial. Take your dog to the nearest faucet. Turn on the cold water, not ice cold, and definitely not direct ice, and let it gently run over the burned area for at least 10 straight minutes. Cold water helps dissipate the heat, reduces pain, and prevents the burn from getting deeper. Why not ice? Direct ice can cause vasoconstriction, meaning the narrowing of blood vessels, which can actually make tissue damage worse due to lack of blood flow. Once the area is nice and cool and the pain has eased a bit, cover the burn with a damp gauze. And here's a crucial tip: no honey, no yogurt, none of those home remedies your grandma might have told you about. Burns are incredibly prone to infections, and the sugar in honey, for example, is a buffet for bacteria. You need a professional evaluation. The vet will assess the depth and extent of the burn and decide whether antibiotics are needed to prevent infection, painkillers to control the pain, or more specific treatments. In the meantime, your job is to keep your dog from licking the wound, since this can introduce bacteria and slow down healing. If you don't have an Elizabethan collar, you can improvise one using a stiff plastic collar cut from a paint bucket or a large detergent container. Make sure the edges aren't sharp. Creativity in an emergency is your ally. And now we come to the fifth and most critical situation. Your dog faints, doesn't respond, and isn't breathing. This is cardiac arrest. Adrenaline kicks in. But remember the hook from the beginning. You have very little time. The first thing is to check the airways. Carefully open their mouth, pull out their tongue, and look for any visible obstruction. Is there anything there? Try to remove it if it's safe and visible. But if not, or if the airway is clear, it's time to act. Lay your dog on their right side on the floor or on a firm surface. Why the right side? Because the heart of most dogs is located just behind the elbow of their left front leg. Now, stack your hands one on top of the other and place them over that area, just behind the elbow. Compress the chest to a depth of 2 fingers for medium and large dogs. For small dogs, use only your thumb and index finger at a rate of 110 compressions per minute. A trick for keeping the rhythm? Think the song Staying Alive by the Bee Gees. That's the perfect tempo. After 30 compressions, it's time for rescue breaths. Close your dog's muzzle with one hand, cover its nose with your mouth, and gently blow until you see its chest rise. Give 2 breaths, then go back to 30 compressions. The cycle is 30 compressions to 2 breaths. Repeat this for 5 cycles and then reassess. Is there a pulse? Is it breathing on its own? If there's no response, continue canine CPR. While it's not always successful, it has a success rate of 1 in 4 cases if started within 2 minutes of cardiac arrest. After that time, the success rate drops dramatically. If you can use a timer on your phone to make sure you keep the rhythm and cycles. Your accuracy and determination can make all the difference. If up to this point you're feeling a bit more empowered and confident, why not give this video a like? That way, the algorithm will recommend it to another owner who might need this vital information later today. Let's help each other out. Before we say goodbye, let's talk about your first aid kit. You don't need an entire pharmacy, but you do need a few key items that could save a life. Sterile gauze and elastic bandages are essential for controlling bleeding and covering wounds. Elastic bandages are also useful for immobilizing. Blunt scissors for cutting bandages or cleaning around a wound without the risk of poking. 3% hydrogen peroxide, useful for cleaning superficial wounds, but always use caution and only under veterinary guidance for deep wounds. Chlorhexidine or povidone iodine can do the same job, even salt water. Emergency thermal blanket, for dogs in shock or with hypothermia. It helps maintain body temperature. Stiff cardboard the size of a magazine, your best friend for improvising a splint in case of a fracture. Disposable gloves, to protect both you and your dog from infections. Sterile saline solution, for washing eyes or wounds. Fine tweezers, to remove splinters or ticks. The best part? All of this fits perfectly in a shoebox and will cost you way less than an emergency vet visit you could have avoided or minimized. Always keep it handy and check the expiration dates on the products. Don't wait for something to happen to be prepared. Save this video to your playlist and please share it in the neighborhood WhatsApp group, the family chat, or with any dog owner you know, because when someone asks with a trembling voice, "What do I do if my dog is choking?" you'll be able to send them the link and save them those crucial minutes that could mean the life or death of their companion. And if you want us to practice CPR together so you feel even more confident with the technique, let me know in the comments. If there's enough interest, I'll upload a step-by-step training soon with clear demonstrations and extra tips. In the meantime, stay calm, trust your hands, and always remember this. Your dog has already chosen you as their hero. All that's left is for you to prove to them that they're absolutely right. See you in the next video.